There was a time when men's sexual problems got all the attention. Those days are over. Women's sexual health has been making headlines lately, but there's still much more women need to know. Joining us today to talk about women's sexual health issues, which impacts women of all ages, is Brooke Faught, Clinical Director of Women's Institute for Sexual Health. Good morning, Brooke.
Good morning. Thank you so much for having me.
You're welcome. Could you explain the current shifts and attitudes towards women's sexual health issues, and why has it taken so long to discuss these issues?
That's a very, very good question. So, first of all, sexual dysfunction in women encompasses issues with sexual desire, arousal, orgasm, and sexual pain. And, the advent of erectile dysfunction medications 20 years ago started this sexual revolution. And it's been a long time coming for the FDA to finally start approving some safe and effective medications for women as well for comparable issues. But honestly, thinking back to different areas of the nation and how women are raised to believe sex should be, I have a lot of patients in my practice that consider or were taught that sex is something that should be kind of a hush-hush topic. And so when they start experiencing problems related to their sexuality, they don't feel that it's something that they can openly discuss even with a medical provider. So knowing that we're starting to see this shift here with more gearing towards women's sexuality, I think it's going to open up major communication lines with women, with not just their medical professionals, but also their friends, their colleagues, their family, and that's going to be a big tipping point for women's sexual medicine.
What are some sexual health issues that women are facing today?
So there have been multiple landmark surveys over the past couple of decades showing that upwards of almost 50% of all women have either one or multiple sexual complaints. The most prevalent are issues with desire and also sexual pain. And specifically women after menopause. Women are living a third of their lives after menopause, and 25 to 50% of women after menopause are going to experience problems with dryness and sexual pain. And in the past, we typically think about menopausal issues using hormonal options, but now there's non-hormonal options that can treat these symptoms just as effectively, if not more. And it's really exciting to see this turn of event and having more options and more sexual freedom for women's right to choose options that are best for them.
Besides women being taught not to talk about sexual health issues, what are some other reasons why they could be reluctant to discuss these issues?
I have a lot of women in my practice that say they are embarrassed to open up to their partner because they don't want their partner to feel that it's their fault or their partner to feel that they don't enjoy sex. And then, just embarrassment. And once again, I live in Nashville, and I've trained out on the East Coast, and I've seen a difference in patient demographic and different populations with their perception and comfort discussing these matters. But in my area currently in Nashville, a lot of women don't feel that it's appropriate to discuss anything related to, their female organs, sexuality, anything in that regard. And so to have somebody to talk to, especially in the medical profession, to let them know, to basically normalize this and to say, well, yes, any sexual complaint is not necessarily a normal issue. It can be quite common, and there are treatment options available for these women.
How can women just start a discussion with their doctor about sexual health issues?
Yeah. A lot of times women think that providers don't want to hear these issues, and they do. Some providers may not be comfortable bringing up the discussion because they're afraid they might offend the patient, and so the patient should feel absolutely comfortable being completely open and honest. And most providers are going to hopefully provide resources, and if they can't provide resources, maybe even a referral to somebody who can discuss this a little bit further with them. But specifically with sexual pain is not a normal occurrence, and it absolutely should be addressed. There are multiple different things that can cause sexual pain, and a lot of times it can be a very simple treatment. And if not, involving the right medical providers to prevent this from becoming a worse issue.
What sexual health issues do women seem to be concerned about the most?
Well, in my practice, I see a lot of sexual pain. I also see a lot of issues with sexual desire. And specifically with sexual desire, there are so many different causes, and a lot of times it's not just it's not an actual medical entity. There might be relationship factors or other factors. But with sexual pain, I see a lot of different age categories. I see a lot of different causes. And it really takes a comprehensive, holistic health assessment to determine what is going on and what's going to be the best treatment option for those patients. So finding someone that has that ability to spend time with them, I think, is really critical to proper treatment.
Is there anything you'd like to say to women with sexual health issues that we have not covered?
Yeah, there are some great resources that they can turn to if they have any questions. One of those is painfulsexaftermenopause.com. And another great resource for both professionals as well as for the general public is ISWISH, which is the International Society for the Study of Women's Sexual Health. And that is a great organization where providers and the general public can find providers in their area that are either trained or interested in treating sexual complaints in women.
I would like to thank you for taking this time to discuss sexual health issues with our viewers today. Have a great day.
Thank you. You too.
Bye.
Bye-bye.